Welcome to the 2023 CNA Member of a Healthcare Team Practice Test. This test has 20 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white. Question 1. Bed making technique includes eliminating wrinkles in the sheets. The CNA knows this technique assists to A. Prevent pressure sores. B. Ensure the client is warm. C. Minimize the need to remake the bed frequently. D. Minimize the need for additional blankets. The correct answer is A. Prevent pressure sores. Eliminating wrinkles in the bed sheets helps to decrease pressure on the skin. Beds should be remade when soiled or as needed. Question 2. Which of the following represents the correct selection of size for a blood pressure cuff? A. The width of the cuff completely encircles the circumference of the arm. B. The width of the cuff is approximately 25% of the circumference of the arm. C. The width of the cuff is approximately 40% of the circumference of the arm. D. The width of the cuff is approximately 10% of the circumference of the arm. The correct answer is C. The width of the cuff is approximately 40% of the circumference of the arm. Selection of the correct size blood pressure cuff is essential to accurate measurement. The width of a blood pressure cuff bladder should encompass approximately 40% of the circumference of the arm. A cuff completely encircling the circumference of the arm would be too large. A cuff encompassing less than 40% would be too small. Question 3. The CNA measures the blood pressure of a client to be 200 over 180. The client is not in distress. What should the CNA do next? A. Ensure the blood pressure cuff used is the correct size and repeat the measurement. B. Record the measurement in the record and continue with the assignment. C. Immediately notify the nursing supervisor. D. Measure the client's temperature and pulse to complete the vitals set. The correct answer is A. Ensure the blood pressure cuff used is the correct size and repeat the measurement. It is important to ensure measurements obtained are correct. This patient is not in distress and therefore the measurement should be repeated. If the reading remains elevated with use of the correct sized cuff, it should then be reported to the licensed nurse. Question 4. Which of the following would the CNA anticipate participating in as part of client care during the shift assignment? A. Administering intravenous medication. B. Dressing a wound. C. Assisting with bathing. D. Assess change in mental status. The correct answer is C. Assisting with bathing. Medication administration is the responsibility of the licensed nurse. Wound dressing and assessment are skilled nursing interventions which must be completed by licensed nursing staff. Assisting a client with bathing is appropriate for the role of the CNA. Question 5. The CNA is assisting a client who is on swallowing precautions after a cerebral vascular accident. Which of the following should be incorporated into the plan of care for this client? A. Client should not be left unattended when eating. B. Client should eat alone in their room to provide for a quieter environment. C. Client should be instructed to tip their head back as they swallow. D. No additional precautions are needed if the client eats only soft foods. The correct answer is A. Client should not be left unattended when eating. Clients on swallowing precautions should not be left unattended when eating due to risk of aspiration. Swallowing precautions include tucking of the chin towards the chest. Clients should be observed during eating even if the food texture is soft. Question 6. The CNA is recording the intake for a client's meal tray. The client has had 8 ounces of milk and 6 ounces of tea. How would this be recorded on the intake log? A. 14 milliliters. B. 240 milliliters. C. 180 milliliters. D. 420 milliliters. The correct answer is D. 420 milliliters. Intake of liquid is recorded in milliliters. 1 ounce of liquid roughly equals 30 milliliters. This client has had 14 ounces of fluid times 30 milliliters per ounce equals 420 milliliters. Question 7. A patient consumes 8 ounces of ice chips. What amount should be recorded on the intake log? A. 8 milliliters, B. 240 milliliters, C. 120 milliliters, D. 180 milliliters. The correct answer is C. 120 milliliters. Ice volume is recorded as 1/2 of the amount. 8 ounces of ice chips is equivalent to 4 ounces of water. 4 ounces times 30 milliliters per ounce equals 120 milliliters. Question 8. When should universal precautions be practiced? A. For all client encounters. B. When the client has an open wound. C. When the client has a fever. D. When the client has a cough. The correct answer is A. For all client encounters. Universal precautions should be utilized for all client encounters to promote safety of clients and staff. Question 9. The CNA is caring for a patient with an infection of Clostridium difficile. Which of the following would the CNA anticipate utilizing in caring for this client? A. Surgical mask. B. N95 respirator. C. Face shield. D. Gown. The correct answer is D. Gown. Clostridium difficile is a gastrointestinal infection. Infection control to decrease spread of this condition includes contact precautions for which a gown would be worn. Question 10. A client has a confirmed case of influenza. The CNA would anticipate using which infection control precautions when caring for this client? A. Contact precautions. B. Respiratory precautions. C. Reverse precautions. D. Blood-borne exposure precautions. The correct answer is B. Respiratory precautions. Influenza is a transmissible respiratory illness. Respiratory precautions should be utilized in addition to universal precautions to reduce transmission of this illness for clients who have confirmed cases of influenza. Question 11. Which of the following demonstrates a CNA intervention to foster client independence? A. Encouraging the client to fully participate in bathing activities as they are able. B. Cutting up a food for the client so they don't have to do it. C. Scheduling meal times for the client. D. Selecting clothing you feel looks best on the client. The correct answer is A. Encouraging the client to fully participate in bathing activities as they are able. Fostering independence includes encouraging and allowing the client to participate in as much of their care as they are able. Assistance should be offered and provided for tasks which the client is not able to complete by themselves. Question 12. The family of a client requests you ambulate the client without using the rolling walker assistive device. The established plan of care indicates the client should utilize the rolling walker when ambulating. What action should you take? A. Ambulate the client according to the wishes of the family. B. Observe the family assist the client to ambulate without the rolling walker. C. Inform the family of the rolling walker as part of the care plan and notify the nurse. D. Ambulate the client utilizing a wheelchair. The correct answer is C. Inform the family of the rolling walker as part of the care plan and notify the nurse. Care plans assist to inform staff of the safety needs of the client. The CNA should follow the care plan and report the changes requested to the nurse. Question 13. While assisting the client with toileting, the CNA notices a foul smell to the urine. What action should the CNA take? A. Notify the nurse. B. Monitor the patient. C. Check the client's blood pressure. D. Encourage the client to take fluids. The correct answer is A. Notify the nurse. Foul-smelling urine may be a sign of an infection and should be reported to the licensed nurse. Question 14. The CNA is assisting a client who wears glasses to assist with low vision. Which of the following interventions should the CNA use to increase safety for this client? A. Use a white and red walking cane. B. Speak directions in a loud volume to ensure the client can hear you. C. Ensure the client is wearing their glasses. D. Leave the room lights on at night so the client can see. The correct answer is C. Ensure the client is wearing their glasses. Clients should have assistive devices in place to increase safety. Use of a walking cane is not automatically indicated simply because a client wears glasses. This client utilizes glasses, and speaking loudly to them will not increase safety. Leaving the room lights on at night may be stressful for clients and decrease their ability to rest at night. Question 15. Which of the following interventions should the CNA utilize to provide client-centered care? A. Share their lunch with the client. B. Learn about the client's preferences and beliefs. C. Contact the chaplain. D. Call their family to provide updates. The correct answer is B. Learn about the client's preferences and beliefs. Client-centered care includes learning about the individual preferences and beliefs of the client so they can be incorporated into nursing care. Question 16. Which of the following represents the correct technique in bathing a client? A. Wash eyes from inner canthus to outer canthus, utilizing a different corner of the washcloth for each eye. B. Wash the peri area first. C. Begin with the feet and progress toward the head. D. Use a new washcloth for each arm and leg. The correct answer is A. Wash eyes from inner canthus to outer canthus, utilizing a different corner of the washcloth for each eye. Infection control is an important part of bathing. The eyes should be washed first, beginning with the inner canthus and wiping towards the outer canthus. Using a different corner of the washcloth prevents spread of possible infection from one eye to the other. Question 17. A client has a sign above their bed indicating NPO. The CNA recognizes this means which of the following? A. Bed rest only. C. No medication, food, or fluids by mouth. C. Seizure risk. D. Client is incontinent. The correct answer is B. No medication, food, or fluids by mouth. NPO is the Latin abbreviation for nil per os, or nothing by mouth. Question 18. Your client is scheduled for vital signs measurement. As you enter the room, you notice she is enjoying a cup of hot coffee. Which of the following should be done? A. Remind the client that this time was reserved for their vitals. B. Proceed with the vitals collection as scheduled. C. Wait 15 minutes after the client has completed the coffee to measure the oral temperature. D. Complete the vital signs measurement and list not applicable for temperature. The correct answer is C. Wait 15 minutes after the client has completed the coffee to measure the oral temperature. Consumption of hot or cold foods can influence the oral temperature measurement. Oral temperature should be completed at least 15 minutes after consumption of this client's coffee. Question 19. The CNA is assisting a client with lower right-sided weakness to ambulate using a cane. Which of the following techniques should be used? A. Place the cane in their right hand. B. Place the cane in their left hand. C. Place the cane in the client's dominant hand. D. Hand placement isn't a factor as long as the client uses the cane. The correct answer is B. Place the cane in their left hand. Placement of the cane in the client's left hand will assist to provide support for the right lower extremity. Question 20. Care for a Foley catheter should include which of the following? A. Keeping the collection bag above the level of the bladder. B. Cleanse the peri area every other day. C. Keeping the collection bag below the level of the bladder. D. Empty the collection bag only when it is full. The correct answer is C. Keeping the collection bag below the level of the bladder. The Foley collection bag should be kept below the level of the bladder. This prevents backflow of bacteria into the urinary system. Perineal hygiene should be performed frequently in clients utilizing Foley catheters. Collection bags should be emptied according to the nursing care plan schedule, which may be more frequently than when it is full. Thank you for watching this video. We hope you enjoyed it. Check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.